Okay, I just want to look at a couple avoidance strategies that a person might use when they're trying to complete a task. And that could be for a variety of different reasons. It could be because there's an injury history at a certain joint that we want to offload. It could be because there's a lack of familiarity with that movement task, especially if it's more on the complex side of things. Or it could just be a weakness, right? Where the body's trying to take a path of least resistance around a weak point. So going from left to right, we've got a single leg squat here where, and this is actually a less egregious version of what he did a couple minutes or a couple seconds before I gave him the auditory cue of thinking about sinking into the knee more than the hip. And so even with that cue, you can see there's a little bit of a hip tilt here. I don't care so much about that. All that really tells me though is that he's probably loading into this glute more so than he is bending his left knee, so sinking into his knee. We'll come back to that. And then in the middle here, we've got a bear crawl. I think crawling sometimes can be tough to depict what we're looking at, but I think a couple big points that I try to look out for is what are the scapula, what are the shoulder blades doing, and where is the center of mass being? So is it shifting drastically or is it kind of staying centered? Is it favoring one side or the other? And what we'll do, I'll slow this down, but when he's putting his weight on his right side, which is right about now, he's kind of planted on his right side, his pelvis does a good job of just kind of staying equidistant between these two legs. It's kind of right in the middle. As soon as he plants his left foot, or even right before, you can see there's this pelvic shift to the right, so that when he plants his left foot, he doesn't have to have as much of his center of mass shifted over to that left side. So you can see it actually kind of drifts over to the right side while his left foot is taking all of his weight. And what that tells me is just offloading that left quad, or maybe it's his big toe or his ankle or somewhere up or down that chain. And then again, on the right side, not so bad at all. Left side right there. Right there. Okay, and then lastly, another single leg squat. But what I want to talk about here is that we've got a heel lift here, which all that really does is it's a couple centimeters of lifting his heel up, which allows for a little bit more space for his ankle and foot joints to kind of move into, so he doesn't get to that jammed up end range, that end point in his ankle as early. What that's going to allow for is a much deeper squat. So he's going a bit fast, but his depth is great, right? Like that's the bottom position right there. And you can see his ass is way closer to his heel on this side versus here. All we changed really was adding a heel lift versus no heel lift. And so again, the pelvic position, a little more horizontal here, a little more laterally tilted there. Doesn't matter so much, but what the outcome of that is that he's having to sink into his knee way more here. So he's bending his knee a lot more in this side versus in this video. And what that logically means is that he's loading his knee extensors a lot more into a lengthened state in this squat versus in this squat, which is exactly what we were after.